principles are designed to help you understand how the body is supposed to react to exercise and what the expected outcome is going to be. I want you to look at the principles as an instruction manual of what your treatment plan is going to be. Once you understand those, you can create a treatment plan or a training plan for your athlete.
There are 12 principles of how we work. The first one comes from kinesiology, basically in physics, which is every action has an equal and opposite reaction. So if I'm running or walking, there's an energy that comes from the ground up, or if I jump down to the step, there's an energy that comes from the ground up that has to be absorbed by the muscles and the joints of the body before it reaches the head. Otherwise, my head is bobbing up and down. Okay, so if we're walking, that energy from the ground force is about 1.5 times our body weight. That 1.5 times the body weight in force needs to be absorbed by the joints and the muscles. Now, if we're running, it's about 2 to 5 times our body weight in force that has to be absorbed. And if we're jumping, it's about 5 to 10 times our body weight in energy that has to be absorbed up the kinetic chain. Okay. So, second principle is that all joints move in 3 planes. So these joints have to absorb the energy, and they all have different kind of characteristics about how they can move to absorb the energy. So that's going to be determined by their structure, kind of the architecture of the joint. Everyone is different. And the ligaments that connect the bones to each other. And here we see the hip, the knee, and the ankle. All the joints have to work together up this is called the kinetic chain. They have to work up the kinetic chain to absorb these forces I was just talking about. So the 3 planes we're talking about are the 3 planes we talk about in orthopedics. Basically, it's the frontal plane, the sagittal plane, the side plane, the frontal plane, and the horizontal plane, or the coronal plane. Some joints are special, like the hip and the shoulder. They have very large range of motion in all the planes. Now, why is this important? Let's talk about the anterior cruciate ligament, the ACL. You know what? Everybody knows what the ACL is? Now, the knee rotates. It'll rotate about 5 degrees or so before the ligaments stop it. So if you're playing a sport and you really have to rotate fast, your hips better rotate along with you, because the knee only rotates a little bit. So if your foot is planted and it's stationary and you're rotating and your hips don't rotate, something has to rotate, and it's going to rotate at the knee, and that's when you tear your ACL, this kind of rotation, too much rotation at the knee. So now we're up to principle number 3. Principle number 3 is the principle that Greg taught me from his observations in athletic training. It's that as we move up the chain and the body absorbs this kinetic energy, it always does so in a mobile, stable, mobile pattern. One joint along the kinetic chain, one segment has to be stabilized so the ones above it and below it can move. We call this the rhythm of the kinetic chain. It has a rhythm. If the rhythm is correct, it's going to look smooth and graceful. So this gives me the 4th concept. Number 4 is look beyond the obvious, or the joint-by-joint approach. So this is a concept actually from personal training that I like very, very much, and I think it helps to understand this mobile, stable, mobile concept. How many of you have ever heard of? So the idea here is that we talked about segments, each body segment, and certain segments have a propensity for certain dysfunctions. Certain segments are dysfunctional in certain ways. They're reproducible and consistent. And the way I think of it is each joint, as we look at the different joints, it's what do they need? What do these joints really require when you're doing your sports? So briefly, the ankle requires mobility. The knee requires stability. The hip requires mobility, and it alternates. See how it alternates every time. The lumbar spine, stability. The thoracic spine, mobility. And that goes in that sequence, which fits into Greg's concept. So the theory here is if there's problems with the mobility of the hips or the mobility of the thoracic spine, you might have a problem at the lumbar spine because there's not enough mobility above and below, so this is going to become mobile, and it needs to be stable. Again, mobile, stable, it alternates, even up to the shoulder and in the hand and the arm, the same concept. So the elbow needs stability. You have to have a stable elbow to throw and things like that, and you need mobility at the wrist, and a lot of times if you don't have that, you start to have elbow pain. So this is the concept, again, from personal training. So when this guy comes to see you and says, my back hurts, what he really is saying is, my hips are not mobile enough. My hips don't have enough mobility, so my lumbar spine is moving, but the lumbar spine is supposed to be stable. And that's the difference in the approach. It's not obvious. It's beyond the obvious. So because of this approach, if you have back pain, it tells you that you have to look at how is the thoracic spine moving? How are the hips moving? Not just the back. If most people with back pain, they have sore back muscles, they might have weak core, but we don't really normally look what's going on above and below. So if we just treat the back, they're not going to get better. It would be like if the fire alarm went off right now, and we decided, well, we'll just go take the batteries out of the fire alarm, because that will stop the noise, but we didn't look at where the fire was.
Now, we know she had ACL surgery, and then her hips aren't working properly. Her right leg is the surgical leg. I'm going to have her step on the BOSU flat side up with a non-surgical leg. No. Right in the middle. And stand up. Now, this is the leg she was balancing on, she was doing much better with. Now, you notice I have her flex the opposite leg, because when you're running, the hip flexor is working when the other leg is stable. Okay? Now, the foot is unstable. Go ahead and do it again. The foot is unstable, so that means the ankle is unstable. That means the knee has to be more stable and the hip has to be stable. Okay? Watch her do that.
大家可以稍微看一下，
She's
它
wobbling a
会
little bit.
摇晃哈，所以它的
Not
脚并没有那么稳定，它的踝关节的部分没有那么的稳定。那在这个情况下，其实膝关节应该就会比较固定在一个角度上。
Let's try it on the surgical leg so you can see the difference.
那我们让他换另外一只脚试试看。
See the difference?
大家应该就可以看到，就是比较不容易站上去做平衡。
Because there's not enough strength in the ankle to support, the knees trying to work and the hips trying to work. That's why she's moving around so much.
The next concept, number 5, it comes from muscle physiology science. And this concept says that the muscle generates the most strength when it's at its normal physiologic resting length. Why? Because at the middle, at the normal resting length, is when the actin and myosin are the most overlapped. Raise your right hand, put 2 fingers inside your hand. Have your wrist relatively straight, just slightly dorsiflex, slightly, like you would rest at the side of your body, like this. And now squeeze your fingers, feel that. Pull your wrist back as far as you can and squeeze again. It's not as strong. And if you put your wrist down, now it's really not as strong. And the reason is the wrist flexor muscles, this is the normal resting length for the wrist flexor muscles. If we go beyond it or shorten it or lengthen it, we get weaker. The strength is in the middle. And the principle is straight is strong. So if we can get people to be like this, where all the muscles, even the spinous muscles, are in the normal physiologic resting length, they're going to be as strong as they possibly can be. And if we deviate from that, we're going to be weaker. So this gets us to the effects of posture, the posture that your body assumes over time. What we want to have is this, where the plumb line, the line of gravity, goes right through the ears and the shoulders and the hips and the ankles. But the reality is that's not that common. So we have, this kind of, a lot of people who are very heavy, we have this in the United States. Or, you can see all these postures. This is very common, the head forward. I have this. And this usually comes with a rounded shoulder. And notice here, the tilt of the pelvis. So we need to see what are the changes in posture, because that means certain muscles are going to be longer and certain muscles are going to be shorter, and that means they're going to be weaker. We also, in addition, we have to check one side of the body versus the other side so that it's also stronger in a symmetrical fashion. So symmetrical is strong too. If you could have weakness on one side of the body, like we just saw with the young lady who came up, that's important as well as the posture. And if you try a Bosu ball, try it yourself, it's almost always one side, you'll be better at one side than the other side. It's very rarely you find somebody who's equal. So this leads me to number 7. We're on number 7 now, and I call these the dynamic stability tests. These are the tests so that we can quickly see where are the problems, what muscles are weak, and what muscles are strong, and can we identify that quickly so we know how we're going to rehabilitate. This is the first one. This is a deep squat. You put your hands on your chest, you do a squat, and you have to keep your heels down and keep your thoracic body over your ankles. If your thoracic body leans forward too much, maybe you don't have the hip mobility or enough thoracic mobility to squat down properly. If your heels come up, are your Achilles too tight?
And this principle says that we work on mobility. So in other words, we work on the short muscles, the muscles with limited range of motion, the tight muscles first. Mobility, before we strengthen those short muscles, we have to mobilize them and get the range of motion. And then we do some strengthening of the weaker muscles before we do the function with the whole body. We'll talk about functional exercise in a minute. So this gentleman, he is on a foam roller. See, he's laying on a roller. If his pec was this tight, you don't want to strengthen this pec. You don't want to add strength to a dysfunctional muscle. You want to mobilize it first and then add strength. One of the principles is we use manual therapy to try, we put our hands on the patient to try to increase the mobility. And we use other techniques to increase the mobility, because remember, mobility first. Here's Greg doing a manual therapy more for the pectoralis and some of the shoulder muscles on a gentleman who had shoulder pain, was very strong. Or he had neck pain, Greg, or shoulder pain? Neck and shoulder pain. As you can see, Greg's using his body weight to stretch this gentleman. And again, we'll be showing you some of these techniques depending on what the situation is over the weekend. So here we also mobilize the joint, not just the muscles, but here we're mobilizing the hip capsule as well. So it's not just the joints that we can use manual therapy on. I mean, the muscles that we can use manual therapy on, we can also use them on the joints. So Greg is pushing down here at the hip capsule. That anterior capsule gets stretched, as well as mobilizing through range of motion. Okay, if Greg doesn't come home with you and he's not, in your house, then you can do it on your own, doing some stretches with a foam roller. This is a static stretch, more of an isolated stretch of the psoas. This is a dynamic stretch, so we're going to actually pick the leg up and stretch the psoas here. So this uses Sherrington's law, which says that if you contract the gluteus muscle or the agonist muscle, the antagonist will relax. If you The opposite side, if you contract your quadriceps, your hamstring relaxes. That's called Sherrington's Law, and that's from physical therapy. So if you contract this glute and bring your foot behind you, the psoas has to stretch, and the psoas is aided in stretching by the contraction of the glute. We're up to principle number 9. Again, we're going to bring muscles to their normal resting length. So we were just talking a little, just right there, about lengthening the shortened muscles. So this is what we're going to try. This is the goal. Correct the posture, correct the symmetry one side to the other. Equal on one side, each left side, right side, and excellent posture. If the muscles are too long, in this case, the gluteus muscles are too lengthened out, which is very common, they sometimes forget how to work. Lengthened muscles tend to become very quiet, and they need to be reactivated. So if you see old men, sometimes you see them and they have no buttocks. They've lost their butt. No, their glutes. This is an exercise for them. This would have this bridge, makes them fire their glute, but we don't want them to arch their back. So if you have to hold a ball here in with your leg up and do it a single leg with a ball here, if you arch your back, the ball falls out. So it teaches you to activate the glute. So these are targeted exercises at specific muscles to strengthen them. After we've done all that, it's time for Greg's specialty, the functional exercise. And functional exercises are exercises that emphasize the core and your posture, and they use multiple joints in multiple planes. This is an example of one functional exercise. And you see that she has to resist the pull of this tether, and she has to work her legs, and she has to catch the ball. Everything working. So she's using multiple joints in multiple planes, but how is her posture? Very good. So what we're doing here in functional exercises, we're going to get strength, but through motion. We're going to strengthen the motion, even the changes in direction. And like Greg just said, this emphasizes that you want to strengthen the movement rather than the individual muscle. Now we're strengthening the movement. We're getting the entire kinetic chain working. All the muscles are working, and the upper body is very still. No motion up here. Posture is good, head is still, and all the lower body is working. Principle number 11 is we utilize taping, like kinesiology tape, or a lightweight brace like the BioSkin brace. And what that does is it increases the proprioceptive feedback to the brain, so we know where our ankle is in space. And we like this type of support because it supports the joints, but it allows the movement. So there's no restriction of movement, the joint is supported, and for kinesiology tape, there's some investigation that maybe it also helps with the blood flow. And it's a great, when you wear it yourself, it's also a great reminder of what the normal position is. It helps the neuromuscular feedback. And this is a little diagram of proprioception. Proprioception is the knowing, I'm not looking at my hand, but I know where my hand is because I have feedback from the muscle spindles in the muscle, the Golgi tendon organs in the musculotendinous junction, the joints themselves, and then the eyes. And I call this slow it down and see it clearly, okay? Slow it down so you can really see what is happening. When we're evaluating an athlete, it's sometimes difficult to really see what is happening in real time. So if we do use high-speed camera, we can slow it down and really see what is occurring. And if you film another athlete and show them the film, that's easier for them to understand what is happening, where the problem is, when they see it themselves. So even an iPhone has some of this capability. So we will put people on the treadmill and use a videotape. We will have them run outside, use a videotape. We'll do videotaping during exercise. The other thing we do is that we compare our athlete or ourselves to the high-level athlete functioning at a high level. And there are always films of elite athletes doing what they do best. So it's not just filming the athlete at a high-speed camera, but also comparing to the elite, to the perfection, and then you can easily see the difference.